Hello, I'm Michael Karnes. Joining us today is Dr. Josh Metzl from UC Health, Steadman Hawkins Clinic, Denver. Today, we'll be talking about some clinical advancements in internal brace ligament augmentation technology. Dr. Metzl, welcome.
Great to be here, thank you.
Thanks for coming. So you have a very active sports practice, being the lead physician for the Colorado Ballet and associate team physician for the Broncos and Rockies. How has the treatment of ankle instability changed in your practice over the years?
That's a fantastic question. I think when I first went into practice, my lateral ligament surgery really focused on suture repair with a prolonged period of immobilization in a cast. I think that the patients did well, but ultimately this led to muscle loss, and return to sport was often around 4 to 6 months. Since the development of internal brace augmentation for lateral ligament repair, the increased strength of the construct has really allowed me to rehab my patients quicker. I'll often allow these patients full weight bearing at 1 to 2 weeks, with a return to sport not uncommon at 10 to 12 weeks postoperatively.
So what was the rationale behind your initial use of internal brace on your first patient?
So the first patient that I took care of with internal brace for lateral ligament repair was an adolescent dancer that wanted to return to her sport as quickly as possible. She went on to do quite well, and I expanded my indications for other patients in my practice. I think this included multiple professional athletes, recreational athletes, obese patients, and manual laborers. Uniformly, all of these patients did quite well, and I've been very pleased with my results.
A lot of surgeons feel that biomechanical data is useful, though clinical data is necessary. How have you used the research on internal brace to change your practice?
Fantastic question. So I think initially it was mostly biomechanical research that supported the use of internal brace in our patients. In particular, there's a nice study in 2014 AJSM showing that internal brace augmentation of lateral ligament repair is at least as strong as the native ligament. I think the most recent clinical publication in Foot and Ankle International has simply reinforced the excellent biomechanical data that we have. In this new study, 81 patients with an average 1-year follow-up did very, very well. They all had extremely high postoperative functional outcome measures, excellent return to sport. In addition, I think it's important to note that range of motion of the operative side was extremely close to the contralateral side, showing that while these patients were stabilized, their ankle joint was not over-constrained.
Have you had any patients specifically in your practice that you've seen similar results?
I've had tremendous results with internal brace augmentation of lateral ligament repair in my practice. I've taken care of multiple high-level and recreational athletes with tremendous outcomes. I think several patients that come to mind would be a professional football player that I utilize lateral ligament augmentation for with internal brace. He was back doing single limb hop by 2 weeks, jogging by 4 weeks, and back to full impact activities by 11 weeks without difficulty. The second patient was a high-level trail runner who had developed 3 years of functional instability. She did quite well with internal brace augmentation of a lateral ligament repair. She was back mountain biking by 6 weeks and running on uneven terrain by 3 months without pain.
What about the everyday patient? The patient that wants to return to full weight bearing faster and maybe rehabilitation?
So I think that the biomechanical and clinical data support that this technique does quite well in everyday patients as well. I think that because of the predictable and reliable strength of the repair, we're able to weight bear these patients quickly, which allows everyday patients to return to recreational activities much quicker than previous generations of lateral ligament surgery.
Based on your experiences, what would you say to your colleagues that haven't yet trialed internal brace technology?
I would give strong consideration to utilizing this technique in any patient that wishes to make a rapid return to sports. It has truly transformed my practice, and I've had uniformly tremendous results utilizing this technique in my active patient population.
Well, that was great. Thanks for joining us today.
Thanks for having me.